Rethinking routine checkups after 70. When we think of staying healthy after 70, most people imagine one thing: regular checkups. It's been drilled into us that screening and testing are essential parts of good healthcare. And for many years, that's been true. Early detection has saved lives. But here's what you're not being told. After a certain age, some medical checkups may do more harm than good. That's right, certain tests can lead to overdiagnosis, unnecessary treatments, anxiety, and even dangerous side effects. This isn't about ignoring health, it's about wise decision-making. As we age, our bodies change. What was once helpful in your 50s or 60s might become risky or even irrelevant in your 70s and beyond. Some screenings are designed to detect diseases that are slow-growing. So slow, in fact, that you're more likely to live a full life without them ever affecting your quality of life. But the treatment for these conditions, that's where the real danger often lies. False positives, invasive follow-ups, unnecessary biopsies, and aggressive treatments can put an elderly person at higher risk of complications than the original condition ever would. Sadly, these downsides are rarely discussed. Medical systems are often designed around early intervention, not personalized care in advanced age. In this video, we're going to uncover 5 common health checkups you may want to avoid, or at least question, after age 70. We'll explore why some of these tests aren't always beneficial, what risks they carry, and how to talk to your doctor about alternatives. This isn't about being anti-medicine, it's about informed, senior-specific healthcare. By the end of this video, you'll be empowered to make smarter choices for your health or the health of a loved one. Remember, longevity isn't just about living longer, it's about living better, with less stress, fewer unnecessary procedures, and more time doing what you love. Let's dive into the first checkup that might be better left off your schedule after 70, and why skipping it could actually protect your health. Stop routine prostate cancer screening, PSA, after 70. For men over 70, one of the most commonly recommended screenings is the PSA test for prostate cancer. It sounds like a good idea. Catch cancer early, treat it fast, and stay healthy, right? Not so fast. According to the U.S. Preventive Services Task Force and multiple geriatric studies, routine PSA screening after age 70 often leads to overdiagnosis and overtreatment. And the consequences can be worse than the disease itself. Prostate cancer in older men is frequently slow-growing. In many cases, it would never cause symptoms, pain, or death. But the PSA test doesn't differentiate between aggressive and non-aggressive cancers. A slightly elevated result may lead to biopsies, surgery, radiation, or hormone therapy, all of which come with serious side effects like incontinence, erectile dysfunction, infection, and fatigue. These risks are especially concerning for older adults who may have other chronic conditions or a reduced ability to recover from invasive procedures. In fact, research shows that many prostate cancers found through screening in elderly men would never become life-threatening, but the treatments themselves can reduce quality of life significantly. So, why is PSA screening still pushed so often? In many cases, it's due to outdated habits or fear-based medicine. Doctors want to do something, patients want reassurance, but that reassurance can come at a steep price. It's important to understand that not all cancers need to be treated, and not all early detection leads to better outcomes in older adults. Instead of automatic screening, experts now recommend a shared decision-making approach. That means sitting down with your doctor and discussing your personal health goals, risks, life expectancy, and overall function. If you're 70, active, and in great health, a case might be made for continued monitoring. But if you're like most seniors, skipping the PSA test may save you from years of unnecessary procedures and stress. The bottom line? More testing doesn't always mean better health. After 70, it's time to rethink the automatic screenings and focus on what truly adds value to your life, not what simply checks a box. Next up, we'll explore a common screening test for women that becomes far less beneficial and potentially harmful after 70. Reconsider mammograms after 70, especially with no risk factors. For women over 70, routine mammograms may not be as helpful or harmless as once believed. While breast cancer is a serious disease and mammograms have saved lives, The benefits of continued screening into your 70s and beyond become less clear, and the risks more pronounced. Here's why. As women age, the likelihood of developing slow-growing breast cancers increases. These types of tumors may never cause symptoms, spread, or impact quality of life. However, mammograms often detect these slow-growing or non-invasive cancers, leading to overtreatment such as surgery, chemotherapy, or radiation. Each of these treatments carries risks like fatigue, weakened immunity, pain, and long-term side effects that may significantly impact senior health. False positives are another concern. A suspicious mammogram can lead to anxiety, repeat imaging, and invasive biopsies, all of which may be unnecessary. These interventions can be physically and emotionally taxing, particularly for women in their 70s and 80s, when the body's ability to bounce back is reduced. What's more, studies have shown that mammograms in older women don't significantly reduce mortality rates compared to younger populations. That's because if a slow-growing cancer is detected at 75, it's highly possible a woman will pass from another cause before the cancer ever becomes life-threatening. In fact, the U.S. Preventive Services Task Force recommends individualized decisions about continuing mammograms after age 74, especially for women who do not have a strong family history or genetic risk. So what should you do instead? Have a frank conversation with your healthcare provider. Ask about your personal risk level. If you've had decades of clear mammograms, have no family history, and feel healthy, you may not need to continue the test annually. Instead, focus on breast awareness, noticing changes, lumps, or pain, and address those issues as they arise. At a certain point, less screening and more living is the better path forward. Every test has a cost, not just financial, but physical and emotional. And after 70, it's time to weigh whether that cost is worth it. In the next section, we'll look at a common heart test that may seem harmless, but could send you down a spiral of unnecessary and invasive procedures. Why routine EKGs or cardiac stress tests might backfire. When it comes to heart health, many seniors believe that getting routine EKGs, electrocardiograms, or stress tests is a proactive way to prevent heart attacks or detect early signs of cardiovascular disease. But after age 70, unless you're experiencing specific symptoms, these tests can actually be more harmful than helpful. Here's why. Routine EKGs and stress tests in asymptomatic seniors, those without symptoms, often produce false positives. The aging heart naturally develops some harmless irregularities, like minor arrhythmias or scar tissue, that look concerning on a scan but don't pose a real threat. Once these are spotted, doctors may recommend further testing like angiograms, CT scans, or even invasive procedures such as cardiac catheterization. This is where the cascade begins. You went in for a simple checkup, and now you're facing radiation exposure, surgical risks, and possibly stent placement or medication regimens you never needed. It's not uncommon for seniors to suffer complications from the testing and treatment process itself, including bleeding, kidney injury from contrast dyes, or new arrhythmias triggered by procedures. Another risk? Overdiagnosis of coronary artery disease in patients who've lived decades with stable heart conditions. The body often compensates well, and without symptoms like chest pain, shortness of breath, or fainting, those test results may only serve to increase fear and confusion. The American College of Cardiology and the Choosing Wisely campaign have both warned against unnecessary heart tests in older adults without symptoms, because in many cases, the cure is riskier than the condition. So what should you do instead? Focus on function and lifestyle. Monitor your blood pressure, cholesterol, and blood sugar with your doctor. Stay physically active. Eat heart-healthy foods, and check in when you feel something is wrong, like sudden fatigue, dizziness, or chest discomfort. Those are signs that warrant a test. Remember, not every test equals prevention. At 70 and beyond, healthcare should be about preserving quality of life, not chasing hypothetical problems that may never manifest. If your doctor recommends a stress test or EKG during a routine visit, ask, what are we hoping to find, and what will we do if we find it? That simple question may save you from an unnecessary medical spiral. Next, we'll look at a test many seniors take without question: bone density scans. But are they really worth it after a certain age? Bone density scans. When they're helpful and when they're not. Bone density scans, also called DEXA scans, are commonly recommended for seniors, especially women, to check for osteoporosis. The intention is good: identify bone loss early and prevent dangerous fractures. But here's the truth that many doctors don't explain. After 70, the value of routine DEXA scans becomes more questionable, especially when results lead to treatments that carry risks of their own. By the time you're in your 70s, some level of bone loss is expected. That doesn't automatically mean you're at high risk of breaking a bone. Yet a slightly low DEXA score may prompt your doctor to prescribe bisphosphonate drugs like Fosamax or Boniva. While these medications can be effective in high-risk individuals, they're often overprescribed in seniors with only minor decreases in bone density. And those drugs come with serious side effects: jawbone deterioration, esophageal damage, severe muscle pain, and even rare types of femur fractures. That's right, bone drugs intended to prevent fractures can sometimes cause them. What's more, these medications often have to be taken for years to show benefit, and many people stop due to side effects before that benefit is realized. So when is a bone scan truly helpful after 70? If you've had a previous fracture, a strong family history of osteoporosis, are underweight, or have been on long-term steroid medications, a DEXA scan may provide valuable insight. But for many seniors who are mobile, eating well, and exercising, a scan might just label you with a diagnosis that creates fear and pressure to medicate unnecessarily. Rather than defaulting to the test, consider focusing on lifestyle interventions that protect your bones naturally. Weight-bearing exercises like walking, Tai Chi, or light resistance training. Ali's calcium and magnesium-rich diet. Equate vitamin D from sunlight or supplements. Wall prevention strategies like balance training and home safety checks. You can live a long, active life even with mild to moderate bone loss. The goal isn't to have perfect bones on paper. It's to avoid the kind of fracture that changes your independence. In many cases, that has more to do with mobility, strength, and safety than your DEXA scan result. In the final section, we'll talk about one of the most promoted and most dangerous: checkups, the full body scan. The truth about full body scans after 70. They sound high-tech, futuristic, and incredibly reassuring. Full body scans that claim to detect hidden cancers, aneurysms, and life-threatening issues before you ever feel a symptom. These scans are often marketed to older adults with a message that feels impossible to ignore. Get peace of mind. Catch problems early. Save your life. But here's the truth that doesn't make the advertisements. Full body scans after 70 are often more dangerous than helpful. These scans, typically done with CT or MRI, expose your body to high levels of radiation and frequently reveal incidental findings. These are things that show up on the scan but are often benign, slow-growing, or completely irrelevant to your health. Yet once they're spotted, they set off a chain reaction. More tests, more specialists, more invasive procedures, and more emotional stress. Imagine being told you have a suspicious spot on your lung or liver, only to endure months of follow-up biopsies and imaging, only to find out it was harmless scar tissue or a cyst you've had for years. In many seniors, these false alarms result in unnecessary surgeries, risky sedation, and sometimes hospitalizations that degrade overall health far more than the original issue ever would have. Another concern is the cumulative radiation exposure from CT scans, especially in older adults with aging cells. The more imaging you undergo, the more your body is subjected to DNA-damaging radiation that can, ironically, increase cancer risk, the very thing these scans claim to prevent. Medical authorities like the FDA, American College of Radiology, and U.S. Preventive Services Task Force strongly caution against the use of full-body scans in asymptomatic individuals, especially seniors. Why? Because no evidence shows that these scans reduce overall mortality, and they carry very real physical and psychological risks. So what should you do instead? Focus on personalized screenings based on symptoms and risk factors. If something feels off, like unexplained weight loss, persistent pain, or difficulty breathing, then targeted imaging makes sense. But scanning your entire body, just to see what's there. After 70, that approach can cause far more harm than good. In the conclusion, we'll bring everything together and explain why the best healthcare after 70 isn't based on routine. It's based on personal choice, informed questions, and quality of life. Finally, personalized, not prescribed, the smarter approach to aging health. If there's one truth that's become clear throughout this video, it's this. After 70, your health journey should not be driven by automatic checklists, but by personal decisions. What worked in your 50s or 60s may not serve you in your 70s and beyond. Your body, your goals, and your risk tolerance have changed, and your healthcare strategy should evolve right along with them. We've uncovered 5 common checkups: PSA tests, mammograms, cardiac stress tests, bone scans, and full body scans that can be unnecessary, misleading, or even harmful in the later decades of life. That doesn't mean all medical testing is bad. It means context is everything. The right test for the right person at the right time can absolutely be life-saving. But too often, seniors are guided by fear-based medicine or outdated routines rather than individualized care. The medical system tends to over-test and over-treat, especially in older adults, without always considering the cost to quality of life. And in this phase of life, that's what matters most: your comfort, clarity, mobility, independence, and peace of mind. A diagnosis you never needed, a treatment with more risks than rewards, or a procedure that sidelines you for months can take away those things. So what's the alternative? It's not avoidance, it's empowered decision-making. Before agreeing to any test, ask your doctor. 2003, what are we looking for? 2005, Lady, will we do if we find something? 2003, what are the possible side effects of follow-up treatments? 2002, outcome of my life, or just complicated? If the answers don't lead to clear benefits, it may be time to say no. This isn't about ignoring your health, it's about honoring it. Staying healthy after 70 doesn't mean chasing every possible condition. It means focusing on what truly serves your well-being, staying active, eating well, sleeping better, managing stress, and nurturing joyful relationships. So the next time you're offered a test just to be safe, remember, not all checkups are created equal. Sometimes the smartest health move is to ask questions, trust your intuition, and choose a path that protects your body, your mind, and your freedom. Because after 70, your life is yours to lead, and your healthcare should reflect that.